Joining us now in our newsroom is Dr. Ram Muleti. He is the Chief Physician Executive at Community Health. Nice to see you.
Hi, how are you?
So there's a alleged investigation probe with health officials investigating Moderna that people who have gotten that shot are 2.5 times more likely to experience myocarditis. So first, do we understand why this could be happening? And could you put this sort of in perspective?
Absolutely. This information actually was probably out back in June as well, suggesting that people who have this mRNA vaccine, Pfizer or Moderna, seem to be having a slightly higher incidence of myocarditis than the general population, typically in males younger than age 30. But when we say higher than normal, so what we're talking about with Pfizer, they found 8 people out of a million getting myocarditis. And with Moderna, it was about 20 people out of a million getting myocarditis. So there is a slightly higher evidence for Moderna. And in general, it's happened with the mRNA, not J&J, but it's still an exceedingly low number of people actually getting the myocarditis. And one other thing I might add, though, is it's also almost all are invariably mild. So people are not dying from this. They are fully recovering from this as well.
Right. So, and then it's interesting how you put it in perspective, because this is, when you look at 2.5 times more likely, and when you actually look at the absolute numbers, from what I understand, you said 8 in a million for Pfizer, and then 20 per million in Moderna. So, right. But then why do you think there would be, why do you think people would be, or health officials would be looking at this data and being concerned?
Well, I think they're just doing their job. So I think what we need to remember is that anything being done with the coronavirus is, it has this, fine-tooth comb, this microscope on it. This is typical for everything that's out there. Any new medication, even for penicillin, anything that we do, the FDA and the drug companies, they want to look for anything that's unusual, out of the ordinary. So this is actually not uncommon. I think with just this heightened scrutiny on what we're doing right now, but to find something that has a side effect of 8 to 10 out of a million is really not that uncommon. And if you think about it, people will have anaphylactic shock with penicillin at a higher rate than that. So we kind of need to keep in mind that, yes, something that's there, but the FDA is doing their job. They're saying, hey, there looks like there's something here. Let's probe into more and see if it's something serious or something not serious. And they're doing exactly what they should be. I do not see a cause for alarm right now. And the main reason not for a cause for alarm is that your chance of a 30-year-old male getting COVID and then getting myocarditis is much, much worse and much more likely than getting from a vaccine. So what the FDA is looking at is, what is the risk versus benefit? And the risk of getting it with the COVID is much greater and much worse than with the vaccine right now.
Dr. Muleti, do we have roughly those numbers, the risk of getting myocarditis of the infection? Just curious.
Yeah, so actually back last fall, when a lot of the big sports teams were looking at it, they did MRI scans of hearts of athletes, and they found 25% of athletes had some evidence of mild myocarditis after COVID. So 1 in 4 people, these are healthy young football players, had some evidence of some heart effect from COVID. So if you're a male and you get COVID, there's a pretty good chance you'll have some effect. Is it long-term or not? We don't know yet. But there definitely is a higher chance of getting some heart effect from COVID itself. And again, I want to mention again, though, when you think about this, 8 in a million, 20 million, that's, you're more likely to get struck by lightning multiple times than to get myocarditis from a vaccine. So we do need to kind of keep things in perspective as we talk about these numbers.
Well, Dr. Muleti, I love how you put that. I mean, not only struck once, but multiple times. And what are the chances of that? Okay, wow. And then I was just thinking maybe for this, I know the numbers are small, we spoke about that, but 3 weeks is Moderna, 4 weeks is Pfizer. Is there such thing as too much? That was my thought. I mean, maybe the window, I knew that was evidence-based in terms of what we're recommending, but is it maybe too soon? That's what I'm hypothesizing, but I don't know.
Actually, no, that's a very good question. Actually, to be honest, we don't know. So is it dose related or not? Unfortunately, the numbers are so small that we don't have enough data. There's several hundred people that have gotten it. Is it due to the dose of the vaccine or something in them? So one thing that's a little unusual, obviously, is that this happened predominantly in males under age 30. We don't know why is that. Why is it not happening in older people, and why is it not happening in males or females as much? So there's still a lot of unknowns to really draw firm conclusions about it. All that being said, though, even if you're a 30-year-old male today, if you walk to my office, I'm a cardiologist, I would still tell you to get any vaccine, because I've seen the complications in young people of getting COVID. And truly, you don't want to do that. you're going to see people having what's called long COVID, where you get short of breath and you're fatigued, where you have this brain fog. So there's so many side effects out of COVID, even for healthy people. You just got to be realistic about that too.
I mean, right, there's just data coming out that this younger population are just, it's younger compared, I think it was a study from compared to 2020 and 2021. I mean, the numbers are so much higher in terms of younger people getting infected and passing away. So I don't know what the reason is, maybe not getting vaccinated or,
well,
yeah.
I can tell you in our hospitals as we speak today, more than half the people are younger than age 50. And the reason for this is the Delta variant. The Delta variant is different from what we had last year. So Delta variant seems to definitely affect young patients, and those are the most commonly unvaccinated. But there seems to be something about younger people with the Delta variant. So again, more than half the people are younger now in our hospital beds as we speak. So I don't want people to think just because I'm younger, I'm Superman, it's not going to affect me. It may not. But the problem is you don't want to be the one that figures out if it's you or not, though. And it's pretty scary to see some of these people that are young and otherwise healthy getting sick. So it's the whole game. It's a game changer having this Delta variant that's causing this to happen.
That's so interesting that it might be affecting younger people in a way that we just don't know yet. Right. That's very puzzling. You think it would be this, that's a little bit upside down.
Right.
And
we don't have the answers for that yet either right now.
And this, I want to teach me a lesson, Dr. Yoleti. Okay, this past year was the first year I'd gotten a flu shot, 2020, because I'm like, oh, I'm young, I'm healthy, it's fine, I'm not going to get the flu. You tell me and say, Mary, I need to just sit down in my office and say it has nothing to do with you being young and healthy. The virus doesn't care. What would you tell me?
Make
sure, or would you be as stern as that?
I would. There's no question. I tell every one of my patients, you got to get these shots. And the reason is that there's really no major side effects with the shots. And so getting down with the flu or COVID can really bring you down. And you could be one of those unfortunate people that really don't have a good outcome. And also, if you're going to hang around your parents or your grandparents, they can get very sick. And so you unknowingly can get people around you, your own blood relatives, sick because you chose not to get a vaccine. And so I think it's just about take care of yourself, but just as much take care of others too. And the problem with the flu vaccine is that it's not 100%. So we're talking about 95% efficacy for COVID. Flu last year, the flu vaccine was 49% effective. And so it's better than nothing. So we need to kind of keep things in mind that we need to use every tool we have in our toolbox to reduce the chance of us getting sick, and most importantly, our family members from getting sick.
Right, works both ends, both sides. And it was described to me by one doctor I was talking to. When you get the shot, your body knows what's happening, so it can immediately rev up that immune system. Whereas if you don't get the shot, it is just chaos.
That's exactly right. The entire idea of the immune system is exactly that. Is the immune system has what's called memory cells. So if the first injection vaccine is to trigger those memory cells, so they'll remember this the next time the real thing comes. So it actually puts into place into the memory cells what COVID or flu can look like. So when the real thing comes on, it's all hands on deck. And so that's the entire idea of vaccine, is that instead of the first time, they're armed and ready to go when the real thing comes, whenever that may be.
Wow, memory cells. What do we know? Is there a specific memory cell, or are they just called in general? I'm sure there's many, but
yeah. There's several types. There's two basic ones. One's called memory T cell and memory B cells. They do slightly different functions. But one of the reasons that's important to know that is that we look at measuring antibodies. And so, hey, if I got the vaccine, if I got COVID, let me check my antibody status. One of the reasons I don't think that's the greatest thing to do is that there's no blood test for memory B cells, or memory T cells. So you may not have antibodies, but those cells are revved up. So you're still probably going to do just fine in terms of protection. So it's another form of protection like antibodies that these memory B cells, memory T cells have that we can't measure easily, which is just another form of attack. So our immune system is a pretty incredible machine, very complex, but it comes in with 6 different ways of attacking a virus. Antibodies is one of them. These T cells and B cells are another way of attacking the viruses.
That's incredible. Isn't the body amazing? It's incredible.
It is phenomenal how it does it, because basically, it's just like anything else, that you're going to have multiple lines of defense, because the body knows that just having one line of defense may not cut it. So let's have as many different lines of defense as we can have. And that's exactly what the body does. It's a phenomenal thing it does.
Yeah, well, I'm a medical physiologist. So I love, how they work independently and how they all work together. It's just it's incredible. So
It's actually, it's
that's
like
why we go on tangents, Dr. Yoletti. I'm sorry. Yeah. Okay. I won't take up too much of your time. I want to I'll circle back to the investigation. So how might this affect vaccine hesitancy? What do you think? I mean, this has been leaked, vaccine hesitancy, both with
yeah.
the general population, but also with parents and children.
Yeah, so this can affect vaccine hesitancy. And I think, again, for parents and their children, though, I think one thing you want to keep in mind is that, again, you don't want your child to get COVID. And so it's always a risk-benefit analysis. All my children got the mRNA vaccine. And I would do that again. And so it's a risk-benefit analysis, is that we're hearing about the side effects of the vaccine, but we can't forget the side effects of COVID. And I just can't tell you enough that the side effects of COVID are so great. And let me tell you one thing. In the state of Indiana, our own department says that if you're unvaccinated, you're 50 times more likely to get COVID in the next month than if you're not vaccinated. So it's just, you're so prone to it because the Delta virus is just so contagious. And again, you want to remember is that regardless of the side effects of the vaccines, you just don't want to get COVID. And I just can't stress that enough. It's a bad thing to get. Even if you feel good today, you have these long-term complications that we don't know about. So you just want to do everything you can. And I'll be honest, masks are okay, but they're much lower in terms of our defense protection than a vaccination. So mask is really way down. It's if you have nothing else to do, but vaccine versus mask, there's just no comparison.
Right, no contest.
Yeah.
Well, I wanted to ask you one more thing, and it's very important, but I just forgot. Oh, shucks. Okay, anything else you want to add in terms of this?
Yeah, and I think it's important.
Oh, I'm sorry. I wanted, last year was, I'm sorry, I didn't mean to interrupt you, but came right back. You're so right. Last year, we were so focused on side effects of COVID. And now this year, side effects of the vaccine, effects of the vaccine. So when you put that, we need to look at last year when people were infected with COVID versus, the 8 in 1 million, 20 in 1 million. So that's a excellent point. And if you could just summarize that one more time for me.
Yes, so I think it's very important in terms of the vaccines and the side effects, what you're hearing, this is standard. We do this for every drug in the world, every vaccine in the world. What you want to decide is that do you want to get a side effect of the vaccine or do you want to get side effect of COVID? And hands down, under no circumstance do you want to get COVID whatsoever. I don't care if you're 20 or 80, the long-term effects of COVID are terrible. And we have proof of that. Even if there's some small long-term effects of the vaccine, there's still like 1,000-fold greater chance you're going to feel worse getting COVID than the vaccine. So what you're hearing is not uncommon for every drug out there. You probably took an antibiotic. The antibiotic you took has a lot more side effects than the vaccine. So you're hearing it, but kind of put things in perspective. And remember, you do not want to get COVID. Talk to anybody that has had COVID. Ask them if they really want to get COVID again, and you'll have your answer.
Dr. Yoletti, thank you so much. Always great to have your insight. Thank you so much.
Absolutely. I hope it helps. All right.